Hello, I am Molly, and welcome to a very special episode of Care Experts Live. Now, this is brought to you by CareCredit in partnership with Lens Crafters. CareCredit is a health, wellness, and personal care credit card that has helped millions of people with promotional financing options and is accepted at hundreds of thousands of provider and retail locations nationwide. So I see that we already have some folks in the live stream here. Thank you so much for joining us. Sarah 24, Monica, thank you all so much for being here. Today we will be answering your questions about eye health and vision care. So let's meet our care expert. Today we are joined by Dr. Meredith Barber. Dr. Meredith Barber, OD, specializes in fitting contact lenses and treating eye diseases. She is the recipient of the Lens Crafters Diamond Club President's Award for Top Doctor, as well as the President's Pin for Outstanding Patient Care and Customer Service. Through the charity One Sight, Essilor Luxottica Foundation, she has also helped to provide vision care to underserved communities around the world. Welcome to the show, Dr. Barber. Thank you so much for joining us.
Hi, Molly. Thank you so much for having me. Yes, I'm Dr. Meredith Barber. I'm an optometrist and owner of two independent Doctor of Optometry offices next to Lens Crafters at Beverly Plaza and Culver City. I'm also a provider for Eye Exam of California. And like you said, in my 15 years partnership with Lens Crafters, I've had the privilege to work with the One Sight Essilor Luxottica Foundation. I've traveled all over the world providing eye care to underserved populations in Mexico, Malaysia, Chile, and even here at home. So we get to travel and do these clinics and provide eye care and glasses to patients who normally couldn't receive them. So it's been very rewarding.
That's absolutely incredible. And we're so lucky to have you here today with your wealth of experience so that we can talk all things vision care. So before we get started and get to some of your questions here, I just wanted to ask you a couple questions about yourself. Did you always know that you wanted to help people with their vision health?
Well, growing up, I always wanted to be part of the medical profession. But in my undergraduate, I wasn't quite sure what avenue or what road I wanted to go down. So I took a few years off, and my dad actually had some eyes issues going on that introduced me to the field of optometry and eyes. And I decided to go back to school to become an optometrist. And here we are today.
That is incredible. What an awesome origin story. And then when you're not helping people with vision care, what are you doing in your free time?
Well, I am a mother of two young kids. My son will be 3 in September, and my daughter is 14 months. So they keep me very busy. It's a blessing to watch them grow and learn about the world. We sing a lot of songs and we listen to a lot of music. And then when I'm not playing with them, I try to get out and hike and exercise and also learn the latest and greatest restaurants that are happening in the Los Angeles area. So I would consider myself maybe a little foodie sometimes.
That sounds like a great life. I also enjoy the foodie scene, and in LA we have a lot of it, so it's very exciting. Awesome. Well, now that we've gotten to know you just a little bit more, I want to dive into some of these questions from our viewers that want to know about vision care. So I'm going to start by pulling from our chat here from Erica. This is about children's eye health. And Erica wants to know, she says, I really want to know if children need to wear sunglasses.
So, absolutely. I think we all need to wear sunglasses when we're outside and exposed to the UV. Sun damage can actually start as young as the age of 10. So, getting your children comfortable with wearing glasses and wearing sunglasses when they're outside will help protect the eyes from future damage. We can get what's called pinguicular or pterygium on the eyes. That's a little bit of an overgrowth of tissue on the white of the eyes due to UV light and UV sun exposure. So if we can start our kids wearing sunglasses at a young age, it's really important to get them used to that so that we can protect them for the future.
Absolutely. And that's a very important question for our children, for sure. Okay, so next we're going to go to Steve. So this is about age-related vision changes. So how does vision typically change as we age?
So throughout our lifetime, vision does change. Hopefully, when we're younger, our eyes are progressing and changing in the way where we don't need glasses. But looking at where we are these days, where everybody is on digital devices and screens, we're finding that more and more kids are needing glasses at a younger age in order to see. They're becoming more and more nearsighted or more myopic. So this is a little bit of an epidemic that we're starting to talk about, and trying to do everything that we can in order to delay that progression. Nowadays, we have contact lenses that can help patients delay the progression of myopia or nearsightedness as they get older. Glasses also help. So making sure that your kids are getting their eyes checked and making sure that they're getting the appropriate glasses. Now, as we get older and vision changes, when we get up until our 40s and 50s, vision changes in a way where our eyes no longer have the ability to focus up close. So we start to need reading glasses, and that's normal across the board. So in order to make sure that you're getting your best glasses prescription and getting your best vision care possible, it's really important to make sure that you see your optometrist to check and make sure that you're having the best pair of glasses for you or seeing the best that you can.
That is really great advice. I know we're fielding audience questions, but I'm also taking notes diligently. So next we have Jennifer C wants to know, why is it important to get an annual eye exam?
Well, there's a multitude of reasons why we should get our eyes checked every year. First, we want to make sure that you have the best glasses prescription and the best vision possible. So when you go to get your eyes checked, we're going to check for your glasses exam, check for your glasses prescription, and make sure that you're seeing the best that you can. If you wear contact lenses, most of the time a contact lens prescription is valid for 1 year. So it's really important that you go see your doctor every year to make sure that you get that contact lens prescription updated. Your vision can change over the course of a year with digital device use, computer use, cell phone use. And so making sure that you're getting checked at the eye doctor to make sure that you can see the best that you can with your glasses and contacts is really important. Glasses are on your eyes, but your contact lenses are actually considered a digital device that's actually sitting on the surface of your eyes, and it's a piece of plastic. So when you are coming in for your eye exam, we're checking to make sure that that contact lens is fitting correctly on the eyes. It's not causing any damage. You're not at risk for any eye infections. So those things are super important. The last thing that is what we check in an annual eye exam is your eye health. So when you come into the eye doctor, we offer you two options. You can either do a dilation eye drop, where we put an eye drop in the eyes that dilates the pupil. It lasts about 3 to 4 hours. It's not recommended to drive afterwards. And this allows us to see into the back of the eye to check for any sort of eye diseases. The other option that many optometrists offer is a retinal image or a retinal exam. This is a quick photo that allows us to see inside the back of the eye, gives us a wide range and a wide view of the back, and allows us to check for any sort of eye health diseases that could be going on. Now, did you know that optometrists are actually considered healthcare professionals? So a lot of times patients will actually go and see their eye doctor before they go see their primary care doctor. And when we check your eyes for your annual eye exam, we are also checking for anything that could be indicative of a systemic disease as well. In my time of patient care, I actually have a story of a patient who came in during COVID. And she was a normal, healthy individual. We did her retinal imaging, and I found a little spot of blood in the back of her eye. This was a little concerning. So I sent her to her primary care doctor to have a full health evaluation and to get her blood work. Turns out that she actually had cancer. She came back years later to thank me, telling me that I had saved her life just through her eye exam. Unfortunately, this was during the time of COVID, and her best friend was diagnosed with the same cancer and passed away. So when you come in for your eyes, we want to check and make sure everything is healthy. We want to check and make sure that you're seeing well. But at the end of the day, it's really important to make sure that we do that full health check of the eyes so that we can make sure that we are doing everything we can to keep the patients healthy.
Absolutely. And when you explain it that way, it makes a lot of sense. I'm guilty of not going for my yearly eye exam, but you're right, the eyes can be the window to so much more that's going on with you. So that's really incredible to know.
Absolutely.
Great. So let's do our next question. We actually had a few people. We had Chantel V, Frank, and Terry T asked about dry eye and allergies. So can you tell us more about dry eyes? What causes it, and how can I best treat it?
So I think dry eyes have become a big topic of conversation lately, especially with digital use. When we're sitting on the computer all day long, we don't actually blink our eyes as much. When we're focusing, we're not actually having a lot of tear exchange. And if you think about the surface of your eyes and your tears, it's made up of 3 layers. The top surface of your tears are made up of oil, and then we have water, and then we have mucin at the surface of the eye in order to hold your tears on the eyes. Now, when we blink, we're secreting those oils into the tear film. Those oils come from our meibomian glands along our eyelid margins. So when we're not blinking as much, we're not getting enough oil, the water evaporates, and we end up having dry eye, or what we call meibomian gland dysfunction. And that's accounting for around 80% of dry eye that we see these days. So what can we do for this? Well, first, take breaks. Easier said than done, but we talk about a 20-20-20 rule. Every 20 minutes, look 20 feet for 20 seconds and blink your eyes. Get that tears and get that oil out of those oil glands so that we can resurface those tears and hopefully help with the dryness. The other thing that's recommended to do, we talk about a warm heat mask or a warm compress on the eyes at night. This helps to kind of heat up the oils, which if you think about butter, when you put butter in the microwave, it heats up to liquid. Same thing. We want to heat those oil glands so that they become more liquidy and secrete into the tear film. Cleaning your eyelids and your eyelashes also helps clean up the debris and things that develop on the eyelids and the eyelashes throughout the day. Just washing your face isn't enough. You want to get a preservative-free eyelid scrub to help with that. And finally, preservative-free artificial tears. There has been a lot of talk over the years about artificial tears and contamination of artificial tears. What I recommend to everybody is always to get preservative free and always to get a name brand eye drop to make sure that it's in compliance with health standards and that there's no risk for future eye infections.
Actually taking notes. This is great. Okay. Um, so I know you just went into some solutions for dry eye and all that. So I also had a follow-up on this from Tamar who asks, I'm working on my computer all day long for work. How can I prevent digital eye strain? So I know it's a little similar, but how else can we prevent that digital eye strain from computer work?
Absolutely. So if you think about it, pre-COVID, a lot of us, well, more often than not, were driving into work. Working from home wasn't a big thing at the time. Post-COVID, a lot of us wake up and we head straight to our computer. We're not doing this far away looking, which is what we used to be doing when we were driving on the freeway and stuck in traffic on the 405 trying to get to work. So what's really recommended is, like I said, when you're sitting on the computer all day long, you want to take those breaks. And we talk about, again, that 20-20-20 rule. Every 20 minutes, look 20 feet for 20 seconds. Look out a window, look down a hall, even get up and walk around. The problem is we take breaks and then we're looking at our cell phone. That's not giving your eyes a break from the computer and the digital devices. That's going to cause more eye strain. Think about your eye as a muscle. So as you're looking up close, that muscle is overworking and over accommodating. And by the end of the day, we would expect our eyes to be exhausted. So taking that break, allowing that muscle to relax is really, really important. The other thing that can help with digital eye strain, and there's a lot of talk about blue light lenses help filter out the high efficiency blue light that's emitted from computer screens. If you think about the sun emits UV light. UV light and blue light, or high efficiency blue light, are right next to each other on the wavelength spectrum of light. So when you're sitting out in the sun, sunbathing, we're exhausted by the end of the day. Same thing when you're sitting on your computer all day long without having some help from the digital eye strain, you're going to be exhausted. So wearing blue light glasses does help filter out some of that blue light. It does help you with eye strain by the end of the day and not feeling so tired. So those are kind of the things that I would recommend doing when you're sitting on the computer all day long.
These are incredibly helpful because I know you have that eye strain. It can even cause headaches, lead to other issues as well. So these are great notes as we all stare at our screens all day. Okay, so this has been so incredibly informative, and I really appreciate it. We're going to just take a second to shout out some people in the chat since we've had some more people join us. So I want to say hi to Jessica, Stephanie C, and Fox V in the chat room. Hi, everybody. Thank you so much for joining us on this special episode about vision care in our CareCredit partnership with LensCrafters. We're so happy you're here. So we're going to jump right back in because I know we have some new questions and more people in the chat. So it looks like we have Erica B. When should you take your kids in for their first eye exam? That's a good question.
Absolutely. So usually when your kid is going to the pediatrician, they will do a screening of the eyes when your child is 6 months of age, 1 year of age, 18 months, 2 years old. And so if there's anything out of the ordinary that the pediatrician notices, they usually will refer you to a specialist. You can, in fact, see a pediatric optometrist in order to check your child's eyes to make sure that everything is good. If you're wondering if a doctor is okay and comfortable to see children, there is a website called Infant See, and that has doctors who have agreed to feel comfortable enough to see those children and do the eye exams at a younger age. If everything checks out normal up until the age of 5, that's when I would recommend taking your child to see the optometrist before they start school. A lot of learning disabilities are actually misdiagnosed as learning disabilities instead of vision care problems. So before your child starts school, you really want to make sure that they have the appropriate glasses if they need them. They've checked to make sure that the eyes are teaming together and working together. There's many optometrists out there that specialize in vision therapy and helping patients and children learn how to track and learn how to read more succinctly. So I would definitely recommend that if you have a child who has not seen the eye doctor when they're younger, to take them in before they start school to check and make sure that everything is okay.
Good to know as we inch towards our school time now. So that's great. Thank you. Daniel O would like to know, are there any vitamins or foods that can help keep eyes healthy?
Absolutely. I mean, what we put into our bodies is so important. And, getting the essential nutrients for our bodies and our eyes is really what we're talking about these days. So in order to protect your retina and the inside back surface of the eye, we're talking a lot about carotenoids. Carotenoids are in green leafy vegetables like spinach, kale, broccoli, green peppers, tomatoes. Those are all the kinds of things that are really good to protect your macula and protect the retina and the inside back surface of the eye. If you have a family history of macular degeneration, there has been studies over the years. One is called the AREDS 2 study, and that talks about the importance of taking lutein and zeaxanthin, which are really protective for the macula. The other thing that we can talk about regarding the eyes and what you can eat for your eye health is dry eye. So, getting a lot of omega-3s in your diet is really important to help with that oil gland issue that we were talking about. If you're comfortable with taking fish oils, flaxseed oils, things like that, those are really, really helpful to help replenish that oil layer of the tears. And finally, make sure that you're getting enough water throughout your day. I mean, it's not said enough, and it's really hard to make sure we're drinking all of those ounces, but that helps with your dry eye. That helps with your overall body health, and it's good for you too. So I think those are kind of the things to focus on when you're looking at what's best to eat for your eyes and your eye health.
That is fantastic information. Thank you. And Wendy wanted to follow that up. Wendy K says, are there tips for helping protect my eyes during allergy season?
Well, I think allergies have become worse and worse over the years with just different allergens from the trees and dust and everything else. You can take an oral antihistamine if you are prone to your allergies. There's also various over the counter eye drops that you can use to help with the itchiness, the runny eyes, the watery eyes, the red eyes. I never recommend any redness reducer drop like Visine or Clear Eyes. Those tend to do more harm than good. There is a drop over the counter called Lumify that is the only one that we would recommend to use maximum twice a day, spaced 8 hours apart, to help with redness and irritation. But really at the end of the day, if your eyes are itchy, if they're watery, if they're red, getting an over-the-counter antihistamine eye drop that we said was a name brand and not generic, and then also using preservative-free artificial tears will help to kind of replenish and lubricate the eyes when they're under stress.
Amazing. And if you all are just joining us, we are getting some hot off the presses, amazing information from Dr. Barber, who's joining us about vision care. So I just want to give a shout out to some of our new joiners, Cecilia F., Melissa, and Gina L. Thank you so much for joining the live chat today. We're happy to have you all and excited to be telling you all about vision health with CareCredit and our partner Lens Crafters. So let's get back into it. Giselle Z says, what is myopia? Why is it becoming more common?
So, myopia is another name for nearsightedness. So, nearsightedness means that you can see up close, but you can't see far away. So, the eye works like a camera. And when light comes into the eye, it goes through your visual system and it's supposed to hit the retina, the back surface of the eye, precisely so that you can see clearly. If you have myopia or nearsightedness, it means that your eye is longer. So when light comes in, it's not hitting on the retina, but it's hitting actually in front of the retina. When you put glasses on, or contacts, it moves the light to your retina so that you can see clearly. What's happening over time is that all this eye strain and digital strain is causing the eyes to elongate and get longer. And so it's causing more and more people to become more and more nearsighted. So we've lost track of balancing our up close work with looking outside, playing outside. If you see your kids who are on their digital devices playing Roblox or on the computer throughout the day, I know that they have to for school, but I would definitely try to get them outside viewing, looking far away, balancing the amount of time that they're on their digital devices with being outside and far looking. That has actually been shown to help with delaying the progression of myopia and helping with this issue. In addition to that, for kids these days, we do have options that are helpful in myopia management, myopia control, and delaying the progression. Contact lens options we have now that cause defocus that help to delay that elongation of the eyes. And there's glasses coming down the pipeline as well. So if you feel like your vision in the far away distance is becoming worse and worse and worse, where you're having trouble seeing those street signs, or your kid's squinting to see the TV, make sure you go into the optometrist. Make sure that you get your eyes checked to get the appropriate glasses for you and for your kids, and to make sure that you're really maintaining the best vision possible.
So it sounds like it may be some of those subtle symptoms that parents or even adults need to pay attention to and go in to see a professional about.
Yeah.
Okay, great. So Tommy C says, I've worn glasses forever. How do I know if I'm a good candidate for contact lenses?
So, most patients these days can wear contact lenses. With the newest technology that we have out there, contact lenses have become really mainstream. We have contact lenses that will just allow you to see far. We have contact lenses that correct for your astigmatism. And we actually have contact lenses that can give you both far and near, called multifocals. So, it's really, most patients these days are good candidates for wearing contact lenses. I think at the end of the day, if you wear glasses and contact lenses are something that's on your mind, please bring it up to your eye doctor. We try to ask the questions and see what you're interested in, and see what, if contact lenses were something that you've even thought about. But if it's something that is in the back of your mind, make sure you bring it up to your optometrist so that you can have that conversation of which contact lens that we have is going to be the best for you and for your vision.
That absolutely makes sense. And again, great advice. Thank you so much. Okay, it looks like Erica is asking us, when should you see an optometrist versus an ophthalmologist? Great question.
Yeah, great question. So it can be a little bit confusing, but optometrists, like I said, are considered primary healthcare physicians. And nowadays, optometrists can do a lot more than just glasses and contact lenses. So if you are concerned about an eye infection, if you're concerned about your eye health, you can absolutely see an optometrist. An ophthalmologist, the difference is an ophthalmologist went to medical school. An ophthalmologist is certified in doing surgery. So an ophthalmologist does LASIK. They do vision corrective surgery. They do cataract surgery. They do retina surgery. If you have something that's going on in the back of your eyes, they can monitor and maintain that. An optometrist can do a lot more than you think, though. So, like I said, glasses and contacts, eye health checks. We can manage your glaucoma. We can manage your macular degeneration to a point. If you have an eye infection, I'd recommend seeing your optometrist before you go to urgent care or the ER, and really before you go to the ophthalmologist, because we really can be there for you. And usually you can be able to see the optometrist much more quickly than you're able to see the ophthalmologist. So, when in doubt, give your local optometrist a call if you need something, and see if they can see you, see if they take your insurance. Or, most of optometrists can take CareCredit as well if you're concerned about the price. So, optometrists are doing a lot more these days for eye care and vision care than we used to. And it's great to see where the field is going.
That is so clearly put. Thank you. So the optometrist is your first line of defense, and you can kind of go from there. That's great to know.
Absolutely.
Amazing. All right. Thank you so much, Doctor. We really appreciate you sharing your expertise here on this very special episode of Care Experts Live in partnership with Lens Crafters. Thank you so much. And thank you for all the work that you do, especially for the underserved communities around the world, partnered with Lens Crafters. We really appreciate you and everything you do. And thank you so much for being here in your busy schedule to share your information with us.
Thank you. It's been fun.
And thank you all for watching our Vision episode of Care Experts Live, brought to you in partnership with Lens Crafters. And thanks to everyone who submitted questions. If you missed any of today's Care Experts Live episode, catch up on our weekly podcast series available on all major listening platforms. And all of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of locations nationwide. Visit carecredit.com for more information, and be sure to follow our weekly Care Experts podcast series on your favorite listening platform. And subscribe to the CareCredit YouTube channel for new podcast episodes every Wednesday. Thank you so much for joining us. Thank you, Claire. Thank you, John. Thank you all so much for being here. And we really appreciate your time, and we'll see you soon. Thanks, everybody. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.